there was an all-natural painkiller that didn't rip a hole in the belly, could be taken as much as wanted, had no negative side effects, and could be popped, again, whenever for instant relief. Would you take it? And the answer is, of course, right? Hi everyone, my name is Dr. Charlie Johnson, and I help people get back to normal naturally without things like pills, injections, or surgery. In this video, I want to share how to use movement as that medicine. So that's the miracle drug. It's movement or exercise. So a lot of people come to me because they're frustrated by going through traditional PT or maybe working with a chiropractor or a trainer or something like that. And they've been given this cookie cutter sheet of exercises that they feel they come on in, they sit in the corner, they could do it on their own, they don't get much value from it, they don't get the relief that they're looking for. So that's sort of where I step in, and rather than doing more exercises, I do more with less. So I stay focused, and here's how I want to share with you how you can use movement as medicine. So again, the traditional approach is, hey, come on in. Every week we add all these different exercises, and then get that there's really only 3 possible responses to treatment. You either feel same, you feel better, or you feel worse. Let me spell that one out. Worse. Frown face. And look, if you feel great, or somebody with discomfort goes somewhere and they feel wonderful after, that's awesome. But I would challenge and I'd say, well, hey, what made them feel better? And oftentimes they don't know. And this is troublesome because a lot of these problems might reoccur. You might notice a little tweak here or there, and you have to be able to take control of that and own it and have the knowledge, tools, and understanding to correct it on your own. So if they feel the same, well then the healthcare provider, often the PT, doesn't really know what's making it better or worse, or is this exercise canceling out this one or whatever. And if it's worse, then again, there's lack of understanding about what's making it worse. So this is no good way to try to work through any ache or pain systematically. Instead, what I'd say is cut all this out and instead pick the best 1 or 2 things for that specific problem. And that's done through a specific and detailed movement exam, determining what makes things feel better, what makes things feel worse, and sort of a process there. But get that, even for the people watching, if there's something that feels good and something that doesn't feel so good, pick 1 to 2 specific movements or activities. Maybe that's yoga, maybe that's a specific stretch or strengthening exercise, whatever. Just start there, cut out all of this junk, and just start with the best 1, maybe 2 things. So this way, we know exactly what's working, what's keeping us the same, or what's not working. So that's the first step. It all starts with a question of what could be going on, and we pick the best 1 to 2 things for that specific problem. Now, get that, the first thing that we can do, just like any medication, is we can choose when we take it. So we can pick a time as to when we take it. The next thing we can do is we can change the dose, so how much. And then the other thing we can do is change the frequency, how often. So, hey Charlie, start taking this today, take 200 milligrams and take it every 2 to 4 hours or whatever. That's generally a prescription for traditional medicine. Get that movement. If this is a pill, movement can be used the same way. You can change these same things for maximal relief. So I just saw a woman the other day. She said, Dr. Charlie, PT's not working. I was talking to her. She had a back problem. And I said, well, hey, if I can ask, when do you get your discomfort? She was in the boat of doing all kinds of different exercises. She said, well, a little bit after, around 2, 3 o'clock in the afternoon, as I get later in the day, it gets worse. And I said, all right, when do you do, if movement is medicine, when do you do your exercises? And she said, Dr. Charlie, by the way, if this is 6 a.m. and this is 6 p.m., right, she would get her problems right around 2 to 3 p.m. She said, first thing when I get up, because that's when I have the most time, that's when I do my exercise, even though her pain's okay then. This is when it spikes. So I think it's logical to say that for anybody watching, if anybody's ever experienced a headache, and let's just say it was to come on at 2 o'clock every day, when would we take the medication? Well, we'd take it at 1:30 if we wanted to kind of curb it. We'd take it at 2 o'clock, 2:15, right after it started. We wouldn't take it 8 hours before at 6 a.m. It just wouldn't make sense. But people don't think of doing movement or using movement in that way. So hopefully that makes sense. That could be one little tweak that could be made that might be able to help you out. So we can time it better according to when we get the pain. The next thing we can do is dose it. So how much or how many repetitions do we do it? For how long do we do it? I recommend something over here may take, 30, 45 minutes. And that is just, you can't do that more than once a day. But you would take a pill more than once a day. So with that being said, how much? I would pick something, a specific movement you can do 10 reps. So I'll put it down here, 10 reps, or maybe 30 to 60 seconds. So no longer than a minute to knock this out. And then what you can do is instead of taking it once, you can take it every 2 hours. And what's cool about that is you can really start to see the power of a specific exercise or movement if you do it that frequently. And then, so that's how much you're doing. So the 10 reps or 30 to 60 seconds of a specific movement. And then how often? I just said it, I got ahead of myself. Every hour to 2 hours. So, and that's not a perfect prescription. Just get that. What if we could do something that we know, a specific movement, or in this case, a pill, if movement is the medicine, that we know helps us? What if we could do it quickly and efficiently, and we could do that very frequently throughout the day? How powerful would that be? So hopefully that helps. Stop the chaos. Stop doing a whole sheet of exercises or movements. If there's any type of ache or discomfort there, instead, if you want to find the solution and understand what's making things better, same, or worse, forget about the 30 to 45 minute thing. Instead, better time 1 to 2 of the best movements according to when there's any type of increase in symptoms. You can dose it better such that it's efficient, and then you can do it more frequently such that you can pop the pill, an all-natural pill. Again, it has no bad side effects and can only help you. So for anybody out there who's watching this and sort of had a revelation there, or it was something kind of unique, and they thought, man, what the heck, why didn't I think about that? Then like, share, or comment this to someone who might need to hear it, or call me directly at 484-552-3767. Thanks.